Caregiving is incredibly important for patient well-being, and it reduces medical costs too. So supporting caregivers should be a no-brainer. But it's hard for a health plan or employer to even know who the caregivers are, never mind how to help them out. So that's where Carallel comes in with its personalized guidance and digital tools that help identify and empower caregivers throughout their journeys. Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the HealthBiz podcast, a weekly show where I interview top healthcare leaders about their lives and careers. My guest today is Shara Cohen. She is CEO of Carallel. If you like this episode, please press that like button and subscribe. Shara, welcome to the HealthBiz podcast.
Thanks so much, David. It's great to be here.
Outstanding. So we're going to talk about Carallel. I love the name, but we'll talk about that in a minute. But I want to start off way back and ask about your childhood. Any childhood influences that you had that have stuck with you, or anything else notable from your childhood.
Yeah, I feel like I should lay down on the couch to have this conversation, but happy to start here. I guess, I had a pretty happily vanilla growing up in the suburbs in Southern California, but maybe most impactful or relevant, I early on was both a candy striper and delivered Meals on Wheels. And in the candy striper days, I was too squeamish to actually be on the floor at the hospital. So I was happily ensconced in the gift shop. And that was an early lesson that I appreciated healthcare, but I couldn't be too close to it. And with Meals on Wheels, just getting to see how vulnerable a lot of people are. And as a child, having that eye opener of the supports that society can provide. And so, while we were living the OC lifestyle before it was cool, those were important moments for me and setting me up, I think, for where I am now.
Now, did your parents or family get you involved in that, or is that something that you sought out in terms of the hospital roles and Meals on Wheels?
My mother wanted some activities for us to do together. And so she happily enrolled us or got us invited to be part of the National Charity League, which was an activity all through junior high and high school. I think she liked we liked it because there were teas and events that I was forced to go with her to. But it also really instilled a lot of priority around volunteering and being out in the community. That was a good time in my life to be influenced by that priority. I hope she's not listening. She also valued the volunteering.
We'll make a special. We can cast where these podcasts go. We can decide, and so right. we can narrowcast it and avoid mom. But I'm sure she's proud Perfect. Of you and knew what she was doing. Now, I think you became a history major in college at Berkeley. Is that right?
I did. I thought I was going to grow up to become a photojournalist, and that therefore I could major in anything and just go where the interest took me. And I think that the lesson for me is you should go where your interests take you. And I learned a lot through that discipline, but don't use the research I did on American history as much as I could have used other majors perhaps in my professional life. Maybe that's why I needed to go to Fordham and get the law degree.
That's probably right. But it's supposed to put a plug in for the liberal arts. It's supposed to help you learn how to think and all that. And one of the things is that I actually met a photojournalist the other day. I was a guest speaker at a brunch that I went to, and he said, it's not really possible to make a living as a photojournalist. There's not many that are on staff. They're all kind of freelance. And he was going back to school to get his PhD. He said also most people associate photojournalism with like war correspondence. So he had struggled, I think, to make it, even though he was he's on the Pulitzer judging committee and all this, but he couldn't actually make it as a photojournalist. So it's probably better that you took a different road that led to law school.
I think that there were many years in between Berkeley and law school, but like him, and I guess earlier on, I realized that it wasn't that I was going to be a starving photojournalist, and graduating from Berkeley across the bay from this little internet thing that was starting to happen just was too strong a pull, and so I, like him, wanted to make a living.
So, Cher, I know that there's this temptation across the bay from Berkeley as the internet was starting up, and you had some roles there, but it looks like maybe you didn't leave that side of the bay right away, as I saw there was some kind of work with the Oakland A's, and I assume it wasn't Field of Dreams or whatever. Were
I
you in the
didn't play
batter's
second
box or
base.
no?
Yeah, yeah. I did. I had 2 seasons. I still measure it in seasons, even if I wasn't on the field. I had 2 seasons with the Oakland A's. I started as an intern and had a summer internship in the marketing and promotions department, which I loved. And therefore, when the internship ended, I just kept showing up to work
Yeah,
in the hopes that they were going to give me a job. And it took a long time, but they did. And maybe a good life lesson that I learned from the A's was, by the time it maybe took 6 months before they actually gave me the paying job, and
yeah,
my first project was to design the brochure for the annual Fan Fest, the big festival that kicked off the season. And on the cover talks about how the Fan Fest, all the proceeds benefited the A's Community Fund, which had a flagship program called Read to Succeed to help kids meet their reading goals. And when it was printed for the 40,000 attendees for FanFest, we realized I had spelled meat, MEAT.
yeah.
Not a strong move for teaching kids to meet their reading goals. So it taught me some attention to detail, and anybody who's worked with me knows that I have a very anal retentive streak about about details like that. I think I know why. I was also the mascot, which is also a
I
fun
was going to ask
fact
you about
about
that. It can
my
be kind
time.
of hot. Luckily the weather's like fairly mild in Oakland, but it could be like 130 degrees in that suit if you're not careful.
Yeah, there were some really hot days. Yes,
Yeah. All right.
I
Well, I
I
was going to
remember
say
those vividly.
I was going to say maybe you had some like passive aggressive, attitude toward the vegetarian or vegan community when you put that on there. But um, it sounds like you've gotten past that. See, I thought you thought we were done with that when we stopped discussing your childhood, but you still have to get up off
That
the couch now. After that, I saw you were at and was it called Elm or was it, do you say ELM Exchange?
we called it Elm Exchange. It was originally Education in Legal Medicine, but that doesn't roll off the tongue as easily.
No.
So, but in the peak of malpractice crisis, we were educating physicians on legal responsibilities and what they could be tuned into that would help mitigate risk in their practice. And that was my introduction to healthcare. It was my introduction to legal topics in any level of detail, and it was a great learning experience. It was also a great learning for building a small business and getting customers and getting usage and getting a message out there. So I learned a lot.
So, true confession, Shara, you and I were colleagues after that because I was the chairman of a company called APS, which we didn't call apps and stood for Advanced Practice Strategies. And
That's
you
right.
were and you worked there, so we didn't connect directly through the hiring process, but we got to know one another a little bit at APS. And you weren't there that long, but I had to include it because we were there together.
That's right. That's right. You never these happy accidents in life. Yeah, you were the first board that I had
Yeah,
to interact with. I learned a fair amount from that process as well.
no,
All
that's
the good
good.
questions. You're always good
Yeah.
for a hard question, David.
Yeah.
So far it's okay, but
But when we have the video going, I'm better on the easier questions. I don't want to come off as too much of a troublemaker. But no, those some good times there, and we're working on the whole malpractice issues and trying to actually get out in front of it and educate the practitioners so that they didn't end up in the courtroom at the end of the day. So that has
that's
some
right.
value to it. Now, Emmy, has it got all these weird names of companies? So Emmy, is that an acronym?
That also started as an acronym that went away, and we kept trying to educate people that it was not in all caps, and
Yeah,
you didn't need to do that. But that was also originally expectation management in medical information. I think was
nice.
the impetus, which also this is a good branding lesson
Yeah.
for anybody listening about what not what not to start with.
Now Emmy was Emmy was pretty successful in that built it up and then ended up selling it to Walters Kluwer, which is not an acronym;
That's
it's just a
right.
weird European name or two names. And so, what was that journey like?
That was a spectacular journey. I started with Emmy in 2010. We were about a 40-person team at the time. It's what moved me to Chicago, where I still am 13 years later. Intended to move here for 2 years to be with Emmy, and focused on patient engagement and the notion that people are an underutilized resource in healthcare. And if we can give them tools on their own terms, like when they're not in the clinical settings, that we could really bend the cost curve and drive real outcomes. And we were really successful with that. I think we really documented and demonstrated that impact that we could have. And instead of 2 years, we all stayed until 6 years into my tenure, much longer for the entire business. But in 2016, we sold. We were probably 170 employees at that point, and joined Walters Kluwer and as part of their health division, which was then 1,200 employees globally, and best known for, I think, their up-to-date product, which is really about clinical reference and decision support for clinicians, and got to see leading customer experience for them. Spent 3 years there and really got to see sort of global healthcare delivery. So I had an amazing journey with them, and who couldn't have envisioned that in 2010 coming to work on this startup with Emmy, that it can turn into such a rich journey. So it's a real highlight.
Carallel,
Yeah.
as I mentioned at the outset, I like the name, and I meant that I like the name in general, but it not just that I like it compared to all the lousy names of companies that you're at before, but now that we've gotten through them, I realize maybe that's part of it. But I think I like it because it sounds like caring and parallel, and it's just sounds good. But what is the need for why does the company exist? What's the need that they're serving?
Well, so first of all, since you gave it a shout out, I need to put a shout out to John Banta, one of our co-founders, who had a moment of inspiration in coming up with Carallel, along with 200 other inspirations that were less successful that he had, but Carallel was a stroke of genius. Um, and then in terms of the need, caregiving, being a family caregiver, so we're entirely focused on the non-professional caregiver helping a loved one in need, is that it's really hard, it playing that role or being in that position. And so when I think about the need, I think about it uh, multiple in multiple ways. I think about the macro level. There are a lot of family caregivers out there, and we need them. So just to put it in perspective, 1 in 5 U.S. adults are caregivers today. And if we just focus on, I've been long interested in how people can be better involved in their health and in the healthcare system. If we think about how our population is aging at a macro level, they're today about 17, 18% of our population is over 65, and that's going to be north of 20% in just a little over 15 years. And today, 80% of care in the home is provided by family caregivers. That $600 billion in annual value to the healthcare system. So we've got a growing, aging population that needs care, needs more care, and we've got a significant provider shortage. So this is all to say we need family caregivers. We're already relying on them, and that's only increasing. But one of the great things about what we do and the experience we have doing it is the very human level, the micro level of what the caregiving experience is. So I think about these individual stories every day. We have a caregiver named Cheryl, whose mom has dementia and is living independently, but really threw up some flags for Cheryl when she paid $7,000 to someone to rake the leaves from her lawn. And now Cheryl is in a position of what can she do? What should she do for her mom to maintain the dignity of her living where she wants to live and feel safe and connected, and manage that with the concerns about her safety, her health, her well-being. That cascades into lots of questions for Cheryl. And I think about Jean, another caregiver that we recently interacted with, whose husband is disabled, who is very financially unstable, and called in to one of our team members about how could she afford or could no longer afford incontinence products for her husband, and what that means for their what that indicates, I should say, for their food stability, their medication access, their access to care. All sorts of other flags go up. So, from my perspective, when I think about the need, I think that we as humans thrive on connection, and we want to find the highest level of dignity in how we live and the lowest acuity setting. And I think that family caregivers are just such a fundamental key to us all successfully doing that, and making sure that they're resilient and confident and feel able to take on those responsibilities is really important. So you gave me a soapbox, and I just went right up on it.
There you go.
David, but that's how we think about it.
I'll have to be careful about what other questions I ask, Shara, but
right.
That's a good answer. So, how did you find your way there? Obviously, it's in Chicago, so that's one part of it. But it's not an obvious connection with Wolters Kluwer, more of an obvious connection with what you said you did in high school or junior high as a volunteer. So, how did you manage to get over there?
So there was really two connector points, I think. One is, with Emmy, we really did have this focus on how do we empower people to be more connected with their care and do that strategically so that they could help improve and play a role in managing cost and quality. And so for all the soapbox reasons that I just said, we realized in that endeavor with Emmy that oftentimes there was this hidden force in the family caregiver that we weren't focused on addressing. Our customers were asking questions about, but really also weren't focused on addressing. And so I was always sort of, from that experience, aware of the growing magnitude of the need. And as terrific as my experience was through Emmy into Wolters Kluwer, at 1,200 employees and global scale, I was ready to get back to really building something and getting into an earlier stage organization. And so the combination of that need and just the stage of my career, and being connected to um, the founders at Carallel, John Banta and Hillary Ebach, it just the stars aligned, and I joined in early 2021.
So, caregivers are great, and I don't think anybody would say otherwise, but they also can be a little bit forgotten. They're not paid, it's a family member, it's not that well noticed. And so my question is, like, who cares about caregivers, and how does that, from a business standpoint, how does that influence what you do as a company?
Yeah. So there are really three major entities that I think, or categories of organizations that care about caregivers that we interact with often. Health plans, providers, employers, all dependent on caregivers or impacted by caregiving activities. And so that's really where we're focused. From a health plan, health insurance perspective, we spend a lot of time working with Medicare Advantage plans. We work with ASO and fully insured plans for commercial carriers. Starting to do some work around long-term care and supplemental benefits. Those are groups that are really impacted by the caregiving endeavor, and so whether it's their members who are caregiving or their members who are dependent on caregivers, it's a really important area for us to focus on. We do see increasing care coming from provider organizations, particularly those that are at risk and invested in value-based care, because they are reliant on caregivers in the same way that health plans are to support care plans and to help manage member and patient needs outside of clinical settings. And for employers who are worried about the impacts of caregiving on their employees, there's a lot of discussion out there around the impact of caregiving for sandwich generation caregivers, those who are caring both for an aging parent and a child. That is the workforce. And there was recent data out that 73% of us employees are caregiving in some way. And so that's a big concern for employers, both from a health impact for their employees, from a presenteeism perspective, and for recognizing that it's a concern for employees. And as employers of choice, many organizations are really looking at how do we better serve the needs of our employees. So those are the groups that we think about, and in particular because part of our business model, we want to make sure that we're not creating additional burden for caregivers. And so we really appreciate the partnership of those groups in making services like ours available.
Great. So it sounds like there is a reason and an interest and an acknowledgement of that by just different stakeholders that they want to participate. Now, what is the offering that you actually provide, and how much does it vary from one, caregiver or one customer to the next?
Yeah, so what we provide is a human-led, tech-enabled service focused on making caregiving easier. And so we have a team of caregiving experts that are available on call, on demand, to counsel, to support, to guide, and to assist caregivers through a myriad of challenges that they may be facing. And we couple that with digital tools and a technology platform that we call My Care Desk, which is really the digital home for a circle of care, as we refer to it, to collaborate around the health and wellness of a loved one. And so for our customers, for the healthcare organizations and the employers that we serve, we're really helping them deliver a caregiver strategy that is a member attraction and retention strategy, that's a a clinical extension for them to partner with caregivers to impact outcomes, and really to help them as a service identify, connect with, and better understand the caregivers that they're dependent on. For the caregivers themselves, it is a widely variable experience, just as every caregiving experience is widely variable. So whether people are in sort of anticipatory stages where they're thinking about the needs of their loved one in advance, or all the way through end of life and making really hard, grappling with really hard decisions and hard conversations and challenges, financially and legally and otherwise. We see it all.
What have you done in order to fund the company's growth?
We've taken a pretty, I think, typical path in terms of initial seed funding from friends and family and friendlies. We grew the business in the early years to through that seed funding and some debt financing, and then in November closed a Series A round with venture capital that's really helping us fuel a new phase of growth. And we're also lucky to have partnered with some really terrific customers with the Caregiver Action Network, for whom we provide the national helpline for caregivers, with employers who are concerned about their employees, and with health plans who are really thinking about their members in innovative ways. And so both through that revenue and through the investment partners that we have, we've been off to the races.
So if you look ahead, 3 or 5 years of racing, where are you going to get to?
Well, there are a lot of things that I'm excited about. I think that one, that to have a conversation like this is, I think, indicative of a national conversation that's emerging about caregiving and fueling recognition of the need and focus and growth for an organization like ours. New technology is making it easier and easier for us to deliver the support that we do, and even the human front and empathy that we do at scale, which is really exciting. And as our team grows, it's allowing us to become more and more diverse and better reflect the diversity of the caregiving experience and the people that we serve. And so in terms of what lies ahead, I see all of those things expanding. And I think where we fit in the care economy becomes even more and more exciting, because organizations are really thinking about, how does this connect to my social drivers strategy and determinants of health, and how do I think about this from a health equity lens and connect to other services that I'm introducing to support our members, our patients, and our employees. And so I think that connectivity is exciting for organizations like ours.
So, Shara, I want to ask a last question, which is not to do with the business, unless you want to make it about that. And that's about whether you've had a chance to read any good books lately, anything that you might recommend for our listeners.
Well, David, I have a toddler at home, so my books are I've read a lot of books lately, but they're very short, thankfully. And so I've got a whole host of, the little blue truck that helps the big dump truck out of the muck and mire, that I think is a good one. The Gruffalo is a big favorite. I do have a stack, though, that's growing, of things that I'm really excited about, that I just cracked the first chapter on the gift of caring, saving our parents and ourselves from the perils of modern healthcare, which maybe will balance out the Tabby McTat that I will also be reading. And
I think the kids' books are a little more optimistic. So yeah.
you learn it all anew. It's great.
Great. Well, thanks for sharing those. Well, Shara Cohen, CEO of Carallel, I want to say thank you for joining me today on the HealthBiz podcast.
Thanks so much. It was great to see you.
You've been listening to the HealthBiz podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.